Okay, hi everybody. It's Gemma Delgaudio here, the Director of Marketing at Perfect Teeth. And I today am so happy to be talking with Mindy Rogers, who's a hygienist from Perfect Teeth in Continental Ranch, Arizona. Hi, Mindy. How
Hi,
are
everybody.
you? We're so glad to have you here. And um, Mindy, first of all, thank you so much for joining us. And I am so interested to hear why hygiene, oral hygiene, is a passion of yours. So, could you tell anyone who's listening why you got into be a hygienist?
Absolutely. First off, thank you for having me. Second, I saw such a need for care in the oral hygiene community. I used to work in the medical field taking care of patients, and I would have a lot of patients come in with needs in oral hygiene, and I saw a bunch of neglect as far as their dental care and started doing a lot of research and realizing that the medical aspects of their health, diabetes, stroke, heart attack, all those complications patients faced were actually correlated with their gums and gum health, and it got me interested in dental hygiene, and I fell in love with it. I love the fact I get to take care of patients one-on-one, spend a lot of time with them, but also see them back regularly, and so that's how I got into dental hygiene.
That that is awesome. And so giving back, making sure that people stay healthy in the community is obviously vastly important to you. And we've been talking recently about pregnancy and oral hygiene and oral care. Now, we've spoken a little bit about this, Mindy, and you've got some great points here. So I thought that we should share them with anybody who is interested in learning more. Now, we know that it's really important to take good care of our teeth and gums. But when we're pregnant, we know that this causes a lot of hormonal imbalances, changes, and there is that increase of developing gum disease, right? So I wanted to see what your take on it was, as far as pregnancy and how the gums change during that time, during those 9 months.
Yeah, it's extremely important for a woman who's expecting to make sure that their oral hygiene is maintained. Having an additional cleaning, other than the typical two a year, or coming in with your hygienist to make sure that you don't have any signs of periodontal disease is very important. Not only are the hormonal levels changing with the different progresses in pregnancy, but it causes your mouth to be more vulnerable to dental problems due to the bacterial processes and those hormones that are just raging with the babies growing. You can have increase in tooth decay as well as periodontal disease or infection in the gums that can create problems with an unborn baby as well. And so it's very important to make sure that your gum health is at its best, especially during pregnancy.
So I'm a mother and I get the question all the time, Mindy, as to should I go to the hygienist? Is it safe while I'm pregnant? So let's just set the record straight today. It is safe, right, Mindy, to go and see your hygienist during pregnancy.
Absolutely. It is actually in your best interest to see the hygienist during your pregnancy. Um, your first trimester is one of the most important to make sure that your gum health or your dental health is at a good peak, especially as baby is developing the brain and the stem cells and the neurostructure that basically forms the life growing inside of you. So that is very important. But also, yes, it is safe. It's actually more unsafe to avoid coming to the dentist during pregnancy.
Oh, that's good to know. And then you mentioned also that you could develop dental work needs, certain things of crowns, cavities could form. So, do you know, is it safe to get dental work done while you're pregnant?
It is safe to have dental work done. The safest time during pregnancy is in your second trimester because that's when you're past the crucial stage of growing. But it is safe no matter whether you're in first, second, third trimester. Um, but ideally, second to third trimester is best for your dental restorative needs with the doctor.
I feel like you're helping a lot of people today because there's so many questions around, the safety of the gums. Are we able to do that with our hygienist? Can we see them at any time? Now, the recommendation, is 2 per year if you're a healthy mouth, and then obviously different if you have periodontal disease, which should be managed. By your hygienist, which would be required of a periodontal maintenance and scaling and root planing along those lines. But in terms of after the baby's born, Mindy, so they've had their baby, what happens next? If they do develop periodontal disease, if they do have loss of bone or structure, what would you suggest they do? How soon can they come after having the baby that's safe to see their hygienist again?
There's no real limitation after having the baby as far as a time length to come see the dentist. I encourage moms to come back before their 6-week well check with their OB to make sure that the gums are still doing well, that we're not having issues with gingivitis or the periodontitis, any other concern for bone loss. So there's no real limitations after baby is born. The key is getting moms, especially new moms, back in for their cleanings as life has changed dramatically from having a baby.
Yes. I think a lot of women can relate to that, right, Mindy? So I think you've really helped us today understand what's important to mums, expecting mums, and how they can maintain their oral health during those special 9 months of developing that beautiful baby. So I really want to thank you for helping answer a lot of the questions that we've had around this topic. And you've been amazing. And thank you for taking the time out of your busy schedule, seeing your amazing patients to hang out with us and give some great feedback.
Absolutely. Thank you for having me.
Awesome. And then just a reminder, guys, Mindy is at the Perfect Teeth, the Continental Ranch in Arizona. Go and see her. She is amazing. And we look forward to speaking to you guys on the next podcast. Thank you so much, guys. Bye.